Hi, I'm Dr. Steven Burres, and I just want to take you through a little display of my before and after pictures. Here we see a typical rhinoplasty result. The bridge is a little smaller, the tip's a lot cuter, and the tip is rotated up. Ethnicity doesn't change things too much as long as the doctor has all the right tools. Here we made just her tip smaller. Here we bring in the tip that's over projecting and bring it closer to the face, a common problem. Here we rotate the tip up and reduce a hump. Every nose is a little different, but a lot of them have some of the same problems as well. Most noses fit into the either too large or too small category. Here again we see a nose that is large, over projecting and pointing down. We rotate it up, bring it back closer to the face. It still looks very natural and like the person's own nose, but people always want it a little straighter, a little smoother, bumps removed, and in that regard, nose surgeries often look somewhat the same. Here we simply bring in the nostrils, raise the bridge up a little bit, so ethnic noses can be a little different. Once again, in an Asian nose, we added plastic implant to raise up the bridge. Looks very nice and natural. This is our typical reduction rhinoplasty. Here you notice her nose in the front pictures, and afterwards we see that it looks very nice and natural and suits her a little more. Here again we're taking off a bump, smoothing out the bridge. Likewise here, taking a bump off the top, smoothing the bridge and rotating the tip up a little bit. Again, not an overly large tip or overly small. Here she has a very large nose to begin with. Again, most of these ethnic issues are not too, don't make a very big difference in the results. We're still doing the same kinds of steps, taking a larger nose, making it smaller, revising a tip. We always straighten the inside, and we always like to produce a great airway for people. Most girls much over 14 can have a rhinoplasty. Here we do a revision rhinoplasty. Many of my surgeries are revisions of other people's work. Here we just bring in the nostrils again, making it more natural and suitable. Here we simply bring in an over-projecting tip, for instance, and didn't have to do very much else to the nose to make it nice and natural, whatever suits that individual. Here's a very problematic nose with crooked tip, uneven nostrils, bringing it all together there. Once again, Asian noses and some ethnic noses have some variations. Here we had a tip implant, and it looks really super for her. She had a prior rhinoplasty, again revision rhinoplasty. The doctor has to know all of his options and tools well. Here's a very wide bridge and a wide nose. We make it much thinner. Once again, now you notice the rest of their face, and the nose isn't overly dominating. Here again we have a hump, a somewhat large tip. We do what would be considered a fairly standard reduction. Again, people of all different backgrounds, men, women, different ages. Whenever people have it in their mind that they want to get these improvements, here we just make a little adjustments in the tip. We want people to breathe right as well as look right, so we're often straightening out the inside as well as the outside. We want to produce a good airway as well as a good cosmetic result. Here's a huge bump, it's crooked, and again the nose is just dominating this person's face, and now we see a nice balance of their features. Here's just a small change in the tip, and the nose is just less distracting for this very pretty girl. People always worry, will it change their overall appearance? Here we just bring in the nose, and now it looks very nice and natural. Likewise, a large projecting nose that's dominating the face of a small girl, and we reduce it, and it looks very nice and natural for her. Here we reduce the width and the tip of the nose, and we produce an excellent result. Once again, crookedness, uneven bumps, areas all look much better when they're corrected. Here we just have a very wide bridge, and we straighten that out. Small adjustments to the tip. Likewise, a small tip adjustment, and she had a chin implant at the same time. Often we're doing a lot of extra side procedures at the same time that we do the nose surgery. Insurance may also cover the procedure, so if a person's having breathing problems, sinus problems, allergies, headaches, any of these kinds of symptoms, they should come in and get checked and see how much of their procedure may be covered by their insurance. Here's a bump and a downturning tip. And again, just reducing the projection of the nose can make it much nicer and natural. She has a very pretty girl with small problems in their nose, but they kind of add up. And here when it's straighter, and it looks more natural. And here's a girl with a very large nose, and we just do a very even reduction, and eventually it all heals in nicely. These before and afters, switch the befores on the right. The dent on the nose was from a previous surgery, and we used a cartilage graft to fix that. So all our tools are there. Here we, again, take a very pretty girl and just reduce her nose in different proportions, and she looks great. Likewise, a small hump taken off the bridge can produce excellent results. A girl with a very disproportionate large tip, simply correcting this tip problem makes her nose completely less distracting and changes our view. Same thing for another girl, same kind of problem, overly large tip, and correction does wonders. Here we see someone had a prior rhinoplasty and their tip is rotated up. We bring down their tip and she looks much better. A young girl, a very pretty girl with small issues with her nose, but they all kind of add up. Likewise, a bumpy, crooked nose, we always want to make it straight and even, and then it should look better and breathe better too. Here we see an Asian girl who needs an implant in the nose, and what a nice result that produces for her. This is a Caucasian patient who needed an implant, and it straightened out a lot of bumps and irregularities and gave some good, nice projection. Here we make some small alterations in the tip, and she gets a lovely result. Here's a patient which probably had an old fracture, and we remove that, and the rest of her features really shine. Likewise, again, different ethnicities, it really doesn't matter. Reduction rhinoplasty, and